Good afternoon, good morning, and good evening to everybody. I think we have quite a number of people who have joined us at the moment, 120 participants. A very warm welcome to this first of three webinars that are being hosted by Gavi CSO constituency in partnership with Results UK, Save the Children, Gavi the Vaccine Alliance, USAID Momentum Country, the Geneva Learning Foundation, and the Global Leadership and UNICEF. So a very warm welcome to everybody. We're going to discuss today the delivery of routine immunization services amidst the COVID-19 pandemic. And I can see that there's many online already, which is fantastic to see. And we're very eager to discuss, I suppose, this topic today, given the impact that the COVID-19 pandemic has had on our immunization system. So I think that the real aim and purpose of this talk today is to kind of raise awareness of the importance of routine immunization services, highlight the risks to routine immunization and opportunities to use the introduction and rollout of COVID-19 vaccination to strengthen immunization systems and increase uptake of immunization services, and also showcase some strategies utilized by countries, civil society, and other partners to mitigate against disruptions to routine immunization and highlight opportunities to increase immunization coverage over the course of the pandemic. Also, this is an opportunity to provide an online platform for innovative solutions to immunization partners, some knowledge sharing to try and build on having more resilient immunization programs. So today we're very lucky to be joined by a number of very important speakers who are going to share their experiences. So we have Dr. Viorica Berdaga, who's a senior advisor and deputy chief of immunization at UNICEF HQ. Dr. Berdaga previously held roles as the Chief of Child Survival and Development in Cambodia and Chief of Health and Nutrition in Laos with UNICEF. We're also joined today by Jack Degwa, who's Head of Health Systems and Policy at the Kenyan AIDS NGO Consortium, CANCO, based in Kenya, and is a member of the Gavi Civil Society Steering Committee and the Action for Global Health Advocacy Partnership. We're also joined by Edmund Duado, who's a nurse and vaccinator, who's delivering vaccinations in rural Ghana under the Ghanaian Health Service Ministry of Health. He's also an executive director in the Divine Mother and Child Foundation in Ghana. And finally, we'll be joined by Dr. Chizoba Wanadai, who's an associate scientist at the Johns Hopkins Bloomberg School of Public Health, Nigeria country director at Johns Hopkins University International Vaccine Access Center. And Chizoba also serves as the director for immunization for the USAID funded Momentum Country and Global Leadership Project. And she's a member of the Gavi CSO Constituency Steering Committee. And myself, I'm Laura McLaughlin. I'm a technical officer in life course integration team in the Department of Immunization at the World Health Organization. So it's great to have you all here, and it's very, it's a really good opportunity for us to share experiences, because I can imagine many of you have had to adapt the way we've worked in the past year. So when we think about how the COVID-19 pandemic has impacted routine immunization services and some of the key challenges that we're going to have to experience for 2022 and beyond. We know that prior to COVID, some countries were experiencing backsliding in immunization coverage, while others were really making great strengths in their programs. However, now, with the impact of the COVID-19 pandemic, we saw that many services were disrupted. We saw issues with supply chain. We saw hesitancy with people not wanting to access services because of the pandemic. And as a result of that, we have seen many people who've been missed. Or at least we don't know how many have been missed, unfortunately, in some circumstances. So we're in a situation where there are some unknowns out there. Some countries are very able to track those who have been missed. They have defaulter tracking in place. They know how many children have been dropped out. But in many other countries, this is a really big unknown. And this leads to, I suppose, a moment in the next year or two where we're going to be faced with potentially large outbreaks because of a growing number of susceptibles. We also know that many of our health workers have been very overburdened with work during this period. Not only have they been delivering vaccination during a very difficult time, but they also have added responsibilities of having to consider infection prevention control measures and also delivering of a new vaccine, COVID-19 vaccine, to a new population. So many health workers are used to delivering vaccination to infants and mothers of reproductive age, but now they're having to deliver vaccines to adults and older persons that typically would not be the type of population they would interact with. So I think there are a number of key things that are very important for us to think through and recognize that as a program, immunization is considered to be incredibly strong, and in some aspects, other programs considered to be quite vertical. But I think really going forward, I think immunization is going to have to think about how we can work with other programs, how we can integrate better and work alongside our colleagues in other programs to see how we can deliver immunization in a more equitable manner, and also work together and also to identify those who have been missed. So I think that's some of the key things that we have to try and face and identify over the coming years. And I really hope that, I know that many countries have been doing great efforts to try and build back better and try and see how they can get back to at least where they were prior to the pandemic, or even to build back even better than they were prior to the pandemic. So I really hope that this is something that countries can learn from experiences from some others and see how we can advance and go forward, and really try and improve immunization. But also, as we try to improve immunization, how we can also try and help bring up the coverage of other essential health interventions. So I think this is kind of some of the key things that we'll try and learn from each other over the coming years, but also hopefully through this panel discussion, we can see where some experiences have been successful and where we can see some opportunities for improvement. So I think with that, I think we're going to try and start with one of the first presentations. So I don't know if that could be projected. I think Giovanni is going to put that online. That's great. Thanks, Giovanni. So this is, I suppose, an overview of what's happening today. And we're going to pass over to Dr. Viorica Berdaga, who's going to present to us. Thank you. Over to you, Viorica.
Thank you, Laura. And good morning, good afternoon, good evening, wherever you are. I'm very pleased to be speaking today. And in the few slides that will follow, I aim to kind of highlight or remind about the importance of immunization, show some global trends and the impact of COVID-19 on routine immunization services that actually were covered somewhat by Laura already, highlight the risks and the opportunity that COVID-19 vaccine rollout presents for routine immunization, and we'll conclude with few thoughts on the role of civil society organization and UNICEF experiences on that. Next slide, please. And to start with, just a very quick reminder, I'm sure many people are already familiar with that, but just a quick reminder of immunization benefits. Immunization offers an exceptional return on investment, with each dollar invested against the 10 pathogen giving a return of 26, and leads to reduced mortality. In 2019, alone, under 5 mortality would have been 45% higher without routine vaccination. And with 54 countries off track for SDG target on child mortality reduction, without action now, 48 million children will lose their life by 2030, largely from preventable and treatable causes. Immunization is also a very important entry point for health service delivery and a core component of progress towards universal health coverage. As shown during the COVID-19 pandemic, it's also a very important for outbreak control. And we all know the role of immunization for outbreak prevention and preparedness. Next slide, please. Now, let me turn to immunization coverage trends. And this slide actually features progress for DPT and measles vaccine. And what you can see from this slide is that even before the COVID-19 pandemic, note from 2010 forward, immunization coverage was rather stagnant. And especially if you look at the darker segments of the bars, dark blue and red, these represent kind of 0-dose children, which I'll speak in a minute about, but there has been a stagnation prior to the pandemic. And COVID-19 kind of further disrupted immunization, leading to an additional kind of cohort of unprotected children. With immunization coverage, and these are lines that you see for both DPT and measles, immunization coverage dropped to 2009-2010 level. These unprotected children that I referred to, they're comprised of zero-dose children, those who did not receive any vaccine, and those who were only partially immunized. And if you look at the bottom of the graph, you'll see that the majority of increase in unprotected children in 2020 is due to zero dose. You can see that by comparing the side of the segments within the bars at the bottom of both charts. And I will speak about zero dose children in the next slide more, but the main thing I'd like to highlight here is that we have kind of two distinct groups of zero dose children that may require slightly different approaches in reaching them. There's a pre-pandemic group that we consistently and persistently missed, and there's those missed during the pandemic. And the causes and intervention require different approaches. Next slide, please. And in this slide, I'd like to focus on zero dose children who were kind of persistently missed prior to the pandemic. Many of these data coming from the equity reference groups analysis and papers that you may have seen already. To start with, identifying zero dose children is the very first step in reaching them, so where they are. So the analysis of the equity reference group concluded that over 50% of zero dose children live in these three settings: remote, rural, urban, poor, and in conflict. And the pre-pandemic analysis suggested that nearly 50% of vaccine-preventable death actually occur among zero-dose children. And further, the 2/3 of zero-dose children live in extremely poor households that suffer from multiple deprivation and access not only to immunization, but other essential services, health services, nutrition, water and sanitation. And clusters of zero-dose children are markers of missed communities for multiple services, and therefore represent a good entry point for strengthening primary health care and for the delivery of an integrated package of services. What was also highlighted by the equity reference group is that gender-related barriers on both supply and demand side can significantly undermine immunization programs achievements and require special attention in the programming, design, delivery, and monitoring. Next slide, please. I think Laura has already covered many of them, so just reinforcing what Laura mentioned, the overburdened health systems with routine immunization and primary health care facing the biggest challenges. Many countries, like as of 1st of April, 31 countries postpone at least one vaccine preventable disease campaign. The new vaccine introduction have slowed down, and with only 19 in 2020, which is less than half of any year in the past decade, 2 decades. There has been an erosion of trust and confidence around vaccines, and in many places vaccines are becoming a polarized and political topic. And this is being driven by a number of factors, including concerns around COVID-19 vaccine, mistrust in health systems, government institution, and impact of misinformation. There are increasing risks of disruptions in global vaccine availability, particularly HPV, PCV, and measles. And with economies seriously affected, fiscal space for health and immunization decline, posing challenges to sustaining the same level, let alone increasing the level of allocations to health and immunization. And there are uncertainties, future uncertainties regarding the COVID-19 pandemic evolution and the vaccination programs, how they will look post-COVID, and how COVID-19 vaccination will be integrated in routine immunization and primary health care broadly. Next slide, please. I mean, that was more kind of a negative side, but being on the positive side, COVID-19 vaccine investment also provides some unique opportunities. First, opportunities to strengthen health and immunization system that many governments and many partners have been using. Examples of this include strengthening of cold chain and vaccine management capacity, establishment of social listening and misinformation management system and capacities in the countries that can be applied not only to immunization, but other programming areas. Developments in the real time, improvement in real-time monitoring of vaccine distribution, immunization services delivery, using digital tool, strengthening of disease and adverse effects following immunization surveillance system. Then there has been broader immunization agenda promoted, such as life course immunization and integrated service delivery, as countries and partners are looking to strengthen efficiencies and in delivering services and bundling a number of services, including with COVID-19. Lastly, what I wanted to flag is that there are so many new partners stepping into this space that offers new opportunities for reaching zero-dose children and missed communities. And of course, civil society organizations are among a core group of partners that join this. Next slide, please. So with millions of children missing out on routine immunization and the risk of further backsliding and lost confidence, there's a need for urgent action to actually catch up children who have been missed in the pandemic, but also to reach those who were already missing out on vaccines during pre-pandemic in order to prevent the spread and the emergence of vaccine-preventable diseases that pose the biggest risk to child mortality. Next slide, please. So in terms of the UNICEF priorities, I just wanted to briefly mention, as an institution, one of our core priorities is to close immunity gaps and support the recoveries by ensuring that all the children individuals receive essential vaccines that missed before during the pandemic and facilitate catch-up, to mobilize resources for immunization and primary health care, taking into account that the fiscal space is now more constrained than ever, doing it through evidence-based advocacy to protect aid, but also to expand domestic resources for vaccines, immunization services within broader primary health care, reaching zero-dose communities by improving quality, extending the reach to missed communities that have been mentioned earlier in both development and humanitarian settings, and leverage UNICEF multisectorality to reach zero-dose community with an integrated package of services. Making sure that supply is available by building system resiliencies, ensuring that vaccines are provided on an uninterrupted, sustainable and that supply manner, and that supply is affordable. Strengthening immunization supply chain and effective vaccine management practices, making sure that demand for immunization is generated and sustained through the identification of barriers and enablers, employing people-centered design for social behavior change plans in countries, supporting effective community engagement strategy, and on this point, civil society organizations play a particular role, as well as making sure that there's increased and sustained political and public commitment to immunization. Next slide, please. So recognizing the importance of CSOs actually in all of those areas that I have been mentioned, and recognizing that there's a wide, that CSO comprise actually a quite diverse group at the global, regional, especially country level. I wanted to flag on three main areas on how CSOs can contribute. And the first area where CSO has an important role at all the levels are strengthening and building political will and accountability by advocating for immunization commitment, by holding decision makers and service providers accountable for equitable service delivery. The second area is building community demand. And this is particularly important of those CSOs that are operating in countries, in various communities that speak on behalf of the constituencies they represent. They do it by building trust, confidence, and actively generating demand for immunization and primary health care, tackling misinformation and vaccine hesitancy, and overcoming social and gender-related barriers to immunization. And the third area where CSOs can play a very important role is supplementing public sector service delivery by extending the services to area where government programs, public programs have limited access or are not being effectively utilized. And that include conflict-affected area, internally displaced people, refugees, among others. Next slide, please. In terms of UNICEF recognizes the very important role, a critical role of civil society organization, and every year we partner with nearly 4,000 CSOs in countries all around the world. We have offices in more than 130 countries, programs with the governments of those countries. And we partner with CSOs to implement those programs, provide technical and policy support, and deliver results for children, women, and communities from which they come. Using the partnership modality, UNICEF invests about 1 billion per year in CSO partners at global, regional, and country level. And that spans across the multiple sectors that UNICEF represents: health, nutrition, education, WASH, and social policies. But more specifically on immunization, in 2020, UNICEF partners with more than 150 CSOs with funds from Gavi to support the implementation of immunization activities in the 3 areas that I have mentioned above. Next slide, please. These are just some examples. I won't go through them. You could find them after that in the slide, but we have examples of collaborating with civil society organization in all 3 areas: in Lebanon on advocating and expanding partnership with private sector to build trust in public sector vaccine, in Indonesia on generating community demands, in Ethiopia complementing public service delivery. Next slide, please. And I would like to conclude my presentation by flagging some very specific areas which CSO can support with during the forthcoming World Immunization Week. And by level, at global and regional level, what CSO can do, they can amplify the voice and disseminate key messages, advocate for strengthening of health and immunization systems and protection to protect the aid budget with an increased focus on primary health care. They can position immunization as an entry point for health service delivery and a co-component towards universal health coverage, highlight the role of immunization in strengthening pandemic preparedness and response, while at the country level, CSOs can help advocate for increasing domestic resources for immunization and primary health care, to prioritize communities with zero-dose children with multi-sectoral packaging, and to carry out catch-up campaigns or expanding outreach services in underserved area where government services are not necessarily available. Thank you. I think this was my last slide. Thank you.
Excellent. Thank you so much, Viorica. I think you highlighted a number of key and important things about where we stand in terms of the current status of immunization. I think that you made it very clear, I think, that we now have unfortunately gone back to, we've traveled back in time, unfortunately, almost more than a decade or so in terms of the coverage of immunization. But also I think it's very clear that CSOs play really a huge role in advancing and implementing immunization strategies. And I think it's very important that we think about how this can be used to advocate not only in the upcoming, we have World Immunization Week coming up in a couple of weeks' time, just at the beginning, I think, the last week of April, but how we can try and promote and increase demand and support for immunization. I mean, our colleagues who work in immunization, it's been a very challenging time, and I think the more support we can give them, the better. So Thank you for that. And there are some questions that have been popping up in the Q&A, but I think it's better we leave this to the end until we have all our speakers have spoken, and then we can try and address some of those questions. But if people have additional questions, please add those to the Q&A session. And if there's a specific speaker you want to address a specific question to, please make sure to indicate that in your question. So with that, I think we have our next speaker, Dr. Chizoba Wanadai. So I'll pass it over to you, Chizoba, and look forward to your presentation.
Thank you, Laura. Thank you very much for hosting this. And good afternoon, good morning, everyone. I would just like to talk about routine immunization services in the midst of COVID, looking at the Nigerian context. So as I was preparing this presentation, it occurred to me that you can actually divide the COVID pandemic era into different phases, or the COVID pandemic so far into different phases. And each phase had a unique challenge to routine immunization, and also required, specific strategies and attention to address those challenges. So you would agree with me that there was an early pandemic phase where, so this was approximately after the pandemic was declared and the first 3 months of the pandemic, and was the first wave where there was, in many countries, in Nigeria as well, high COVID transmission, high mortality rates. There were lockdowns and movement restrictions. And at the same time, if you felt the pulse of the people, there was also this huge fear of COVID exposure, or fear of COVID, and particularly a fear of COVID exposure in healthcare settings and immunization settings. And this was not just limited to parents or to clients, but also to healthcare providers as well. And particularly because during that time, there was also a scarcity of PPEs and difficulties with movement. So even immunization service delivery was constrained. So what we see in Nigeria, as well as in other countries, because we're doing a literature review on that, is that there were major disruptions to both the provision of immunization services as well as the demand for immunization services. So campaigns were interrupted, services were interrupted. So that was the early phase. And then around July of 2020, when people became a bit more, should I say, aware of COVID, and there were now guidance documents, particularly guidance documents from WHO, and countries adapted those guidance documents to now start addressing the issue of immunization service delivery. So in that second wave, you had, and this was before the vaccine, before the COVID vaccines became available. So most of the effort was really on instituting non-pharmaceutical interventions, mask wearing, social distancing, avoiding crowds. And then, so from the immunization perspective, there were now adaptations of service provision to provide immunization services safely. And then also at that time, the immunization programs had become more confident in their ability to provide services safely. You now had catch-up routine immunization happening. And so what we see from the data is around this time, there started to be some kind of recovery, whereby in the early period, you saw a huge decline in coverage and in service provision. But from this phase, you started seeing a little bit of a recovery on the routine immunization. And then we now go on to another phase where this is after the COVID vaccines have been developed, trialed, and approved for use. So this will be for Nigeria, this would be around, after December 2021, around February. So from March 2021, Nigeria had their first COVID vaccination rollout. And so that was targeted at priority populations. And also during this time period, there was really a high focus on first of all, getting the COVID vaccine rolled out effectively, and then also getting the vaccines to the target population. And then subsequently down the road, we now have the phase where we are in, where we can say that there is increased COVID vaccine supply, and we have adequate vaccines for the demand, and we're now focusing on mass vaccination. And with that focus on mass vaccination and trying to meet COVID targets of 70%, there is also a threat to routine immunization, because it's the same people who are doing the COVID vaccination that are also doing the routine immunization. It's the same agency, the National Primary Healthcare Development Agency, that coordinates the rollout of the COVID vaccine, that also coordinates routine immunization and SIAs. And a challenge really for this particular phase is the low risk perception of the severity of COVID as a disease, and then high levels of COVID vaccine hesitancy. So when you put these 4 different phases in perspective, you now layer it on, so what did the Nigerian government do to address the different challenges that were inherent in the different phases? In the first phase, people were afraid to get vaccinated. There were real structural barriers for services to be delivered. And now in this phase, it's really around how do we get people to accept the COVID vaccine and at the same time catch up routine immunization. So my next slide. So in my next slide, I'm just going to focus on some of the strategies that the Nigerian government has used in addressing these challenges. The first thing and very important is coordination, strengthening coordination and accountability on routine immunization programs. You will all agree with me that when COVID outbreak happened, there was a lot of interest in helping to address the pandemic. And so with so many partners on the table, there's a risk of chaos and a risk of miscoordination. But what the government did was to establish a strong coordination platform that was headed by the government, including all partners, the traditional WHO, UNICEF, CHI, IVAC, CDC, and co. Everybody was on the table. And there were also new partners brought on board, particularly partners who were stronger in communications and advocacy and social media. So that coordination was really critical to ensuring that everything was streamlined. And with the benefit of virtual platforms, there was quite a lot of virtual meetings happening, both at the national and at sub-national level. And this allowed the program, the MPHCDA, to track routine immunization performance, as well as action points that have been agreed upon at the coordination meetings. Then there's a coordination center in Nigeria called the National Routine Immunization Coordinating Center. That group was then tasked specifically to focus on routine immunization, while the COVID vaccine rollout group was tasked specifically to focus on COVID. So in sharing that responsibility, the government ensured that there was a focus on routine immunization, even as the push for COVID vaccination was underway. So at the NERIC, this is the coordination center I mentioned earlier on, they assigned monitoring and accountability officers for every single state in the country, so that they could be responsible for following up action points that have been agreed upon in this coordination center. So that's at the operational level. Then at the strategic level, at the governance level, the executive director of the National Primary Healthcare Development Agency, that's the agency responsible for the COVID vaccine rollout and for RI, held regular meetings with the executive secretaries of the state primary healthcare agencies. And those ones were in turn tasked to coordinate the affairs at the state level. So it was important to have coordination at the governance level as well as the operational level. And the innovations and the changes that were designed as a result of trying to roll out this strategy were then put into the national strategy for routine immunization and primary healthcare strength. So the government already had a strategy, but then they recognized that it was important to update that strategy. And so to encode all the approaches that have been designed in that strategy document. And so that was the tool. That's also another tool of coordination that was put in place. There are also efforts to build capacity of healthcare workers on the use of IPC measures. And then I'd like to actually focus more on the using data to drive decisions. So in order for the agency to understand how there was a lot of rumors and misinformation about COVID. So, but it was really important to understand to what extent this was affecting routine immunization. So part of the community polling and social listening that was being done for COVID also tried to find out if there was a spillover effect on routine immunization. So that's when we are using community-based data to understand what you need to do for routine immunization. Another another aspect of a data-driven decision that was really implemented was identifying local government areas. So local government areas are the second subnational level in Nigeria after the states. So really identifying the low-performing local government areas, and particularly those local government areas with the highest number of zero-dose children. You heard from the earlier presentation that the COVID disruption increased the number of zero-dose children. So the effort was really to concentrate on the places that had the highest burden of zero-dose children. And then after this was identified, the LGAs were then engaged. And I just go back 1 minute. The LGAs were then engaged, and as part of that engagement, there was now an innovative, should I say, planning framework that was designed from that, called the Zero Dose Operational Plan, which is the ZDROP. So that's one outcome from these efforts to address zero dose following COVID. Further to using data to drive decisions, the government conducted what we call PAPA LQAS. So that is an acronym for, I don't remember what the acronym is for, but LQAS are quick, short surveys that really go down to the subnational level, to the second subnational level at LGs, to give you a quick readout of the performance of a routine immunization. So that was conducted about 3 or 4 months ago to really gauge where things are with routine immunization. And then finally, we know that there's usually a discrepancy between survey data and administrative data. And so there's effort now to improve the quality of the administrative data so that it gives you a better picture of what is happening on the ground. Now, in terms of service delivery, the attempts or the strategies that were used to really ramp up service delivery were the usual ones that we know, which is periodic intensification of routine immunization activities. So the government then targeted these 145 low-performing LGAs with the PIRI. And what this meant was that there was increase in immunization sessions that were happening. There was increase in outreaches, there was increase, and then there was also an integration of RMNCH services to the routine immunization. And then finally, another thing that the government is doing, government and partners are doing, is really to enhance the design of targeted interventions by rolling out human-centered design approach to ensure that frontline health workers know how to solicit and get information from the community to design interventions that are specific to the needs of the community. So this is another aspect that has been put in place more recently to try to change the way that services are provided to make it more appropriate. And then finally, I want to talk about integration. So with integration, we've recognized that there's a lot of resources that's going into COVID with the mass vaccination, with the, to build out of the electronic monitoring system and everything. So there is actually now a very strong and concerted effort to identify ways that routine immunization and other services can be integrated into COVID-19 vaccination across the, all the thematic areas, be it in data reporting, demand generation, or service delivery. And one thing that has been found is that if you are doing outreaches, let's say for COVID vaccination, for education for COVID vaccination, it helps to also carry the vaccines along. So it has to be integrated outreaches that, have the gamut of services on offer when you go to the community. So integration is really underscored in the strategies that have been put out. And then there's also opportunity to integrate, even with COVID, the reproductive, maternal, newborn, and adolescent health and nutrition services. So all these are the strategies that are being pursued by the government. But how do you bring this to life? It means that there has to be integrated micro-planning. Immunization has a long history of doing micro-planning, but not so much other programs. So there is now capacity building going on to ensure that the micro-planning for routine immunization is expanded to include both COVID and the other PHC services that are being integrated. So with that, I will stop and yield the mic to Laura. Thank you.
Thank you, Chizoba. Excellent. It's excellent to hear this update of the work that's been going on in Nigeria. And I think showing the 4 phases and the work that's being done in terms of trying to address the fears of COVID exposure, and then also addressing the low risk perception that followed from that, and then also the low or the high level of vaccine hesitancy is really, we really have to admire the work that's been done by everybody and the major adaptations that's taking. And I really enjoyed the different strategies that the Nigeria team are taking. I think it's really an important aspect. I think many countries have to address how we can try and not only find those that were missed previously, but during this pandemic. And I think that the approaches that are being taken, there's a lot of lessons that can be learned by many others in terms of coordination, building capacity. And I really particularly admired the fact when you talk about data, you also talk about social data, trying to get information from the community-based data. And I think a lot of times people tend to focus on other numbers, but they don't focus on the qualitative aspect or really what's happening in the community. So thank you very much for that. And with that, I think we're going to speak to our next speaker, Jack Degwa, and really keen to hear your experiences from Kenya, and I suppose what opportunities you see in your country to try and strengthen and increase uptake of routine immunization as a result of the COVID-19 pandemic. So over to you.
Okay, yeah, thank you. And I'm glad that my first 2 presenters have really talked quite well, Dr. Barika, Dr. Chizoba. I think I will more focus on the opportunities. I'm sure the challenges mostly has been across the board that has been as a result of COVID-19. And I think just to start with, allow me just to mention, a few things around, general challenges that we faced in country, and then I just go straight to some of the opportunities. I'll be talking more from the Kenyan perspective, and also a little bit from the civil society perspective. I think one, COVID-19 is not anything, the pandemic was not anything new it's not anything new to any one of us, more looking at the disruption of the health system. And I think also COVID-19 also exposed the vulnerability of our health systems. And that affected mostly the service provision and all that. And as a result, potentially today we do have a higher number of unvaccinated children who obviously remains susceptible to various immunization. But just to start, just to mention in summary in terms of what we can talk about in terms of the challenges, we are looking at it from, I think for me, 3 areas very clearly. One, the challenge of delivery, the question of sustainability. And I think another interesting area that we might need to have deeper conversation on, it's also how COVID-19 has impacted transition from, especially for those countries that are Gavi eligible. it has obviously affected the transition and transition trajectory. The case of Kenya was more to do with 2027. And that's obviously going to be an interesting discussion to see how the transition journey, the transition phase, despite the COVID-19 and the challenges, how that is going to roll out. But I want to focus on a few areas more around the opportunities and more focusing on our experiences in country as civil society. And I look at it mostly from the four angles, which are four key issues that we'll be talking about. There still remain a lot of opportunities for us to be able to improve our immunization coverage in country. One around accelerating political engagement. I think this has been mentioned earlier on, but we can talk a little bit more about this, more borrowing from our Kenyan context. That speaks a lot more in terms of engaging the members of parliament, more from the health committee, the budget committee, together with the minister. Now, this has been our experience in country after 2020, mostly in 2021, having an opportunity in country to engage the members of parliament, both in the budget and the health committee, more looking at how do we improve financial sustainability of immunization, both in the context of COVID-19, but also in the context of transition. And in the Kenyan context, I can be able to share, we've been able to bear much fruit, whereby we organize this high-level engagement and the National Vaccines and Immunization Program, that is the API, they're able to share their budget just before, not only their budget, but also their gaps, just before the reading of the budget. And for the year 2020, 2021, which mostly the meetings were done in 2021, we had some positive outcome. So there's still an opportunity for us in terms of trying to accelerate a strong political engagement, not only engaging the members of parliament, but also decision makers, both at the national level, subnational level, and all the way going down there. It also means that there's an opportunity to build new champions who are going to support in what was mentioned earlier on, mobilize domestic resource mobilization with a focus on health system and immunization in the context of COVID-19. I think that becomes an area of opportunity. The other one is more focusing again on promoting equitable access and utilization of routine immunization services. In the Kenya context, as non-state actors, and obviously we've been quite lucky to work very closely with the Gavi, the Vaccine Alliance. We've been supporting what we refer to as defaulter tracking. And with a lot of interest with what the earlier presenters mentioned, the zero-dose children. So this is whereby we work within the community health structure, working through the community health volunteers or community health workers, and working through the health facilities to track those children who have been left out of immunization for whatever reason. Could it be as a result of COVID and the challenges you faced, or even prior and even post, and you're working with those community health volunteers, then there's a system that supports in tracking and bringing those children back for immunization. And then a little bit of a compensation for the community health volunteers in doing that work. I believe there's still an opportunity to continue doing the defaulter tracking, but that has a lot again to do with the need for us to invest in what I'll call as a robust routine immunization data system. Because unless then we get to have a good data system that help us to know which children have been immunized and which children need to be tracked, then becomes a bit difficult. And that's been our experience trying to work with the health facilities together with the immunization system to make sure that the data system or the data and the tracking system, they are well thought and they are well done, and we are able to utilize it to be able to do that. And I think the other thing in terms of, again, promoting access has been very closely working with there's an opportunity in terms of working with the media. The media is such a key player. And this presents an opportunity for us to work with the national media, but most important, I believe, is working with the local media at the local level. These are the local FM stations, the print media, as much as possible to make sure that we are promoting the value and importance of immunization. For Kenya, 2020, just at the onset of COVID and some part of 2021, with the introduction of HPV, the country faced some challenges, especially from religious institutions, not all of them, but quite a few of them. And I think this is where the media was very useful in terms of supporting the country, spreading the right information as in the onslaught by some of those quotas that were quite hesitant. And I think it more came from the introduction of the HPV vaccine, which somehow was across the board. There are other opportunities. So the use of local media is very important, the media campaigns, and to emphasize the importance of child immunization. And I think out of our past experience as a country, this has really supported us in working well. The other opportunity we have seen is around program policies and strategies that obviously can be able to contribute to increased uptake of immunization. And allow me to mention one area that we have supported working closely with the national government, that is a micro planning and mapping strategies at the community level. To give more accurate data within the various catchment. And this is more focused on some of those areas that have been doing so poorly when it comes to immunization. So then using the micro planning and the mapping strategies at that lower level, and then getting, the accurate data within those catchments. How again do you come up with ACSM strategies, that is advocacy, communication, social mobilization, targeting the caregivers and also targeting those children and making sure that they are brought back to immunization. I think that becomes an interesting opportunity, micro planning and various working on mapping strategies. We have had an opportunity as a country to, and I'm glad Dr. Chizoba has mentioned this, to work on periodic intensification of routine immunization, more to improve coverage that has been affected by COVID-19. And this has been done in Kenya. Kenya has organized 2 periodic intensification for routine immunization. These are more campaigns, and also at the same time having an opportunity to organize the supplementary immunization activities like the measles, rubella campaign for Kenya in the year 2021. Just looking at our performance, how poor it was, and also being careful around the measles outbreak. So an opportunity also within the supplementary immunization activities and the PRIs, just to make sure that the coverage really goes up. I think the other opportunity that still stands out for us is what I refer to as multi-stakeholder advocacy, aimed at countering misinformation. I think I've talked about the media campaigns, why that is important, but I think this was quite helpful for us, and especially as a country when we were working on the HPV that had an issue, and a lot of issues around disinformation or disseminating the wrong information, and at the same time, the issues that were being raised around the safety of some of those vaccines. So a couple of opportunities around all that. And I think I've talked a little bit about investing in a robust routine data system, I think, and that has really helped us in working on default tracking. My last point is we still have an opportunity around strengthening immunization supply chain and logistics system. The health system, obviously the immunization supply system has been affected seriously by COVID-19. So again, how do we strengthen that in country to make sure there's availability of quality vaccines? The supplies are ongoing, national and subnational level. And the Kenyan case is really a good case study to look at how the immunization supply chain works, and how that then in country have supported in the delivery of the same and even moving forward. And I think the last point is more around data management, which I've talked about, and information for timely decision making at national and the various and also at the subnational level. So I think in a nutshell, I look at it more looking at the opportunity. We do have those opportunities around political engagement, promoting equitable access, again, going to utilization and working on demand generation, the question of the supply chain, and also the question of immunization data. I think those are some of our experiences that we can be able to share, mostly at the country level. And there's a lot that needs to be done for us to be able to bring back our immunization coverage to where it used to be. And thank you for now.
Thank you very much, John. I think you've provided a real rich breadth of opportunities, and I think it's always good to focus on on the positives, because I think there is a lot of vulnerability, as you said, in our programs, but there are opportunities, and I think many of it involves quite a lot of engagement, not only at the senior level with ministries of parliament, but also with our communities. So I think this is an excellent overview of the experience in Kenya, and there's been a couple of questions asked during that. So once we get to the end, we'll start going through some of the questions. But if anybody has further questions, please enter those in the Q&A, and we look forward to addressing that with the panelists at the end. So our final speaker today is Edwin Duodo. So Edward, we're looking forward to hearing from you and hearing about what solutions there could be for mitigating challenges and building a more resilient immunization system. So it'd be great to hear your experience from Ghana. So over to you.
Thank you very much, Laura. Good morning, good afternoon, and then good evening to everyone. Greetings from Ghana. So I'll be speaking on the solutions to mitigate the challenges and building resilience within immunization. And I'll be talking around the Ghanaian context as well. And so as a community health nurse from Ghana, we are basically into providing immunization and vaccination activities. So when the pandemic started, a lot of my people, colleagues like me, were so scared because of lack of resources to work with. But then we've been able to pass through, we've been able to provide vaccination to a lot of people in Ghana here. So with what we have done now, we need to have, we've gotten some solutions, and I will be able to share those solutions to everybody for us to see how best we'll be able to address issues concerning routine immunization in our various destinations or in our various countries. The first thing, as I rightly said, there was that kind of, we had some fear, the fear of the unknown. What is going to happen? Are we safe to provide immunization services in this scenario? In this pandemic? These are some of the questions as community health nurses and as people who provide immunization services were asking. For instance, in Ghana, there are a lot of places where there's inadequate storage facilities. So if we are going to provide routine immunization or vaccination to the people, especially when we had some vaccines with low temperature needed, that kind of cold chain that will be able to provide or store the vaccines. For instance, the Pfizer and the Moderna. But then the infrastructure was not there. So one key solution for us here that I want us to discuss is for us to strengthen our immunization infrastructure. If we're able to strengthen our immunization infrastructure, then it will be so easier for us to address issues on immunization. So we in Ghana, as a result of that, the government was able to buy or procure new storage facilities for immunization. And so it has really helped us a lot. In places where there were no electricity, we had them supplying cold chain facilities which are or which were powered by the solar, powered by solar. It really went on very well with us because we are able to provide immunization which is so safe for people. Another thing is that with information, we've been able to strengthen or provided a lot more information. With the use of the e-tracker, there's an electronic tracker here in Ghana here, where we are using, it is used to manage individual records and also to remind individuals when they are due for the next vaccination. So our first thing or the solution that I am bringing on board is for us to strengthen our immunization structure. It goes in with the storage facility, the cold chain equipment and all these things. If we are able to strengthen that infrastructure, we'll be able to provide safe and effective vaccines for the people. The next aspect is for us to invest in human resource. Investing in human resource means that we need qualified people. We need trained people. We need trained health personnel to provide immunization. In Ghana, immunization is provided by community health nurses, public health nurses, and other preventive care health professional. But then the number of people providing such services are just few. And so for us to mitigate, for us to ensure that we are providing a lot more vaccines to people, we need to invest in the human infrastructure or the human resources. We need more community health nurses. We need more community health workers. We need more community health volunteers in the various communities. So if we have more community health volunteers who are well motivated, we'll be able to provide more immunization services for people. So our community health volunteers in Ghana, for instance, visit various homes, register people, trace defaulters. If we have a lot more people who are well motivated, community health volunteers are not giving anything, but then we need to motivate them. We need to make sure that these people are motivated so that they'll be able to work voluntarily for people. And when they do this, we are going to strengthen our community health services. Our health system will be strengthened. So as a community health nurse myself, we need more of these people who are well trained to support us in our activities. And then also, our community health volunteers will be able to, as I said, will be able to track, locate, and engage defaulting caregivers. And also, they'll be able to provide surveillance services. You know, we need to provide more surveillance services so that we'll be able to identify diseases or pandemics as early as possible. So with the help of our volunteers, they were able to identify, they were taught to know the signs and symptoms of COVID-19. And therefore they were able to identify such cases, such symptoms for us to be, for the community health nurse or the health workers to attend to easily. And so investing in human resources will go a long way to help in addressing immunization challenges. Another thing that I want us to talk about is to collaboration and engagement of stakeholders. And what do I mean by that? I mean CSOs, private companies or private entities will have to come together. In Ghana, the CSOs and the non-governmental organizations did very well in addressing issues around COVID-19. CSOs were with their communities. They were providing advocacy programs. They were doing sensitization programs. They were mobilizing people for immunization. As I'm talking to you now, the CSOs have volunteers who are mobilizing people for vaccination. They are addressing myths and misconceptions. They are addressing hesitancy issues. And this is what is really happening and really helping us in Ghana here. And I think we can now adopt such strategies in our various places. What again? In Ghana and in some parts of Africa, there's a use of technology, which is really helping here in Ghana. For example, we have the drone services. The drone services deliver vaccines to hard-to-reach areas. So where transportation is a major issue, where accessibility is a major issue, we have drone services here, which provides or send in vaccines to such hard-to-reach areas. And it is really helping us. So in your comfort, you know, if you are even in places where we are not able to store vaccines very well, where the storage facility is not there, the central point where the drone services are has a good storage facility. So on the day that you're providing your outreach services, you just request for the services, and within few minutes, the vaccines will be at the community where you are providing the outreach services. And therefore, immediately you get the vaccine through the drone services, you just provide your outreach services wherever you are. And this is also another way that we can all embrace to help sure to mitigate issues or challenges in immunization. Another issue that we shouldn't forget is financing. You know, looking at Africa and looking at the developing countries, there were a lot of difficulties to raise funds for COVID-19. We all had that issue. In fact, there were questions. We are developing countries. we are, I mean, low performing countries. How are we going to raise money, funds to support COVID-19 activities, including COVID-19 vaccines? So there is the need for us to have a discussion on how, yeah, it's before COVID-19, there has been discussions on how we can really raise funds domestically to support immunization activities. And this is the time for us to go back to the drawing table and think around, how are we going to mobilize resources, I mean, domestically, to support immunization activity, including COVID-19 vaccination? This is the time for us to look into it. Are we going to have tax? Or are we going to tax? Are we going to use tax to, I mean, finance our immunization activities? Or are we going to have this kind of health insurance policies? For instance, in Ghana, we have what we call the National Health Insurance Scheme, which support us. It's a social intervention in terms of health, which support us in healthcare activities. But then immunization is not part of the health insurance. So in Ghana, are we going to look into that aspect where we can enroll the immunization activities onto the National Health Insurance Scheme? It's a question that we should be asking. You know, this is the time for us to raise funds to support immunization. And as developing country, we need to do more in that aspect to finance. So both private entities, I mean, public private partnership will really go a long way in raising funds for COVID-19. In conclusion, we need to also have these solutions. And that is the first thing, is community sensitization. And it has been a very key solution here in Ghana by using the mass media, the traditional media, and then the social media. If you go on social media, you'll be seeing a lot of information, people sharing information through the mass media, both on television and on radio. You will see people, government agencies, CSOs, they're on radio, trying to sensitize people on COVID-19 vaccination, which has really helped here. We need to also identify community champions. In fact, if we want to address issues on COVID-19 vaccination, we need to have what we call community champions. These champions can be people, respected people from their community, people who believe in vaccination, people who believe in, I mean, health issues. And these people will be identified to support us and to address issues. Such people can be traditional leaders. In Africa and in Ghana, we have the chiefs, we have the queen mothers, and we have people who are really respected in the community. We have religious leaders, because we are very, very religious. And so we can have community champions who will be religious leaders to address issues. And this will really also help us to, mitigate the issues around COVID-19 vaccination. We need to also have more incentive packages and motivation for our community health nurses, community health volunteers, and community health workers. And I believe that the more we motivate them, it could be just identification purposes, just a name tag, just a certificate. Because these people, the community health volunteers, are not paid. But then if we're able to award them, if we're able to give them some certificate, some identification in their community, for them to feel so special, it will really go a long way in addressing such issues. So with these few points that I have, which I want to summarize, we need to strengthen the immunization infrastructure. We need to invest in the human resources. There should be collaboration and engagement of stakeholders. We need to use technology as a tool in immunization. We need to have domestic financing for immunization. And then also, we need to have community sensitization. We need to identify and select community champions. And we need to provide incentives for our community health volunteers and community health workers. These are some of the solutions that I think will really help us in addressing issues and also improve routine immunization moving forward. Thank you very much.
Excellent. Thank you so much, Edmund. I think you've really hit on many critical points. And I think the last one you made about needing to motivate our health workers and make them feel special and important in our communities is really, really key. And it's something that, by ensuring that we have trust and commitment in these people who deliver our essential health services, we can only but increase trust we have in amongst our whole communities themselves. So I think there's been quite a number of very, very key and important points made by all our panelists. And I've noticed that in the Q&A, there've been a number of questions that have been asked. So I'm going to ask all our panelists to kind of join us back together, and we have like 15 minutes for Q&A, and we'll try and go through some of these questions. But I think some of the first ones that we'll address, I think I'm going to go to you, Viorica, if you're still online. I think was a question that has been already answered, but there's one that relates to some of the advantages of health system strengthening, supply chain and CSO engagement amongst UNICEF, and the effects of that. Have there been any patterns seen in middle income countries compared to low income countries? I don't know if you can see that question there, but there's quite a lot of questions there that are being asked. But if generally, I think they want to try and understand if there has been any any differences in terms of between the middle income countries and low income countries, and also about the need to build resilient health systems to respond to shocks and lack of preparedness and response plans, and what lessons can be learned from COVID-19. So over to you.
Thank you, Laura. I see when you said that several questions have been answered, shall I just concentrate on this last one on middle income countries? I think
that's, yeah, please.
Yeah, okay, so thank you for the question, and thank you for a great interest in the topic. In terms of the middle income countries, first I wanted to say that the role of middle income countries is kind of difficult to overstate, because currently 70% of zero-dose children actually live in middle-income countries, as opposed to just 20% a few decades ago. So 70% zero-dose children are in middle-income countries. And although many of them are characterized as having stronger health systems, they do face some particular challenges. And usually, and these are countries like in Latin America, I think, LACRO, but these are also countries in Europe, some countries in East Asia Pacific. And some of the issues that I wanted to stress are the first, vaccine hesitancy and increasing mistrust in vaccines, especially among relatively educated populations and strong anti-vaccination movements. So in this sense, CSOs have a key role to play in engaging with public, with community, to build trust in vaccination. The other thing that characterizes many middle-income countries is that many of them, unlike low-income countries or some of the middle-income countries who are Gavi eligible, many of them did not introduce new and underutilized vaccines, and they have a higher burden of certain diseases because of that. And many of them may also pay higher prices for vaccines, which require advocacy, engagement, not only to protect and expand budget for vaccines, but also to encourage the introduction of new vaccines. And I think from Gavi Alliance, there's now an opportunity through the middle income country approach that offer the possibility of for these countries to address the backsliding, but also introduce new vaccines. And lastly, the third point that I wanted to make on middle income countries is that many of them have fragmented data systems or paper-based data system and weaker information management, which results in kind of inadequate data, timeliness, use, availability to make programmatic decisions, including data on vaccine stocks, which can be part of the issue that, of the challenges, bottlenecks that prevents reaching zero-dose children. So I hope I
thank you, Viorica. No, that's good. And just one additional question I want to ask you, because it kind of relates to gender and supply, and I know that those are two areas that UNICEF are very involved in, but the question relates to, can you say more about the supply side, gender barriers pre-COVID, and how and if they have changed with COVID-19?
Well, if I think about supply side barriers, and by no means I'm a gender expert, I would think that the human resource within health sector in particular, they can in some places may over rely on women, and while in other places there can be insufficient women in the workforce. It's really context specific, but the point that I wanted to make is that where you have a shortage of staff, or staff that perhaps do not necessarily addresses the barriers to using immunization services, then that can have an impact, and that women, especially during the pandemic, have been the ones that are mostly affected by needing to take care of their families, increased workload associated with the response during the pandemic. So looking at the workforce, the role of women in the workforce, or the balance between women and men in the workforce, making sure that you have services that are culturally accepted would be very important from the supply side. But this is one of the work that UNICEF does invest, and perhaps after the webinar we can share some of the available analysis, and that can be distributed to the participants of the webinar. Over.
Great, thank you, Ulrika. Chizoba, there were a number of questions. I think your example from Nigeria certainly sparked a lot of interest. And one question relates to, in Nigeria, in the last 2 of the 4 phases, what has been the impact on routine immunization coverage? So people want to know, what has been the impact of these strategies that have been implemented?
Okay, thank you very much for that question. What we've seen in Nigeria is that in the last 2 phases, so with the vaccine rollout, early vaccine rollout, and the current phase, there really has been an effort to catch up. I know that in August of 2020 or late 2020, the government rolled out a catch-up campaign. And they rolled out a catch-up campaign to ensure that kids who were missed during the acute phase were caught up. And then with the mass vaccination that is currently in place now, when health workers go with COVID vaccines, they also go with routine immunization vaccines. And there's a lot of experience with doing this. Remember, Nigeria fought polio for the longest time. And the immunization program is actually very good at doing campaigns. After doing polio campaigns for decades, for more than a decade. So they've been able to imbibe and understand how to plan a campaign, how to deliver integrated campaigns, how to monitor campaigns, and how to mobilize the communities to come out. So the results are actually evident in the most recent NICS mix. I think there was a conversation going on in the chat where routine immunization coverage has actually increased in Nigeria overall. It's gone to, I believe it's around 75% or thereabout. Previously, it was 33%. The NICS mix in 2016, 2017 showed that it was Penta 3 coverage was 33%. Now it's gone up to around 70-something%, I believe. So I think that's a huge improvement. And some of the states that had lagged behind, like Kebbi State, right now had the highest improvement in coverage from around 11% to about 50% or thereabouts. The results will be made available soon. So we're seeing the impact of, or the positive impact of the strategies that have been put in place. Mind you, it's not just the strategies to counteract the disruptions that came about with COVID. Right from 2018, the government has actually put in place, government and partners have put in place some really interesting, innovative tailored interventions to improve routine immunization. And we're beginning to see those results.
Great, and Chizoba, leading on to that, there's a question from Esther from Path asking, what are the innovative approaches that CSOs have employed to improve and sustain demand in Nigeria?
Okay, so some of the innovative approaches that CSOs particularly have used have to do with sort of more holistic approach to immunization. I know an organization called Vaccine Network. They have communities that they've adopted, and they started out trying to improve routine immunization. But when they got to the community, they realized that the community's main problems are not, they didn't even know about immunization. So it wasn't a problem to them. But their concern was sanitation. There were open sewers in the area. Their concern had to do with their children were not going to school. They did not have a school. They didn't have a nursery school. The women wanted family planning and all that. And so what that organization did was actually to address the needs of the community alongside introducing the concept of routine immunization. So when they go to the community, they will come along with them, they bring along with them immunization providers from the primary healthcare setting. And so as they're, let's say the day they want to have community sanitation to clean up the area, they will also come with immunization services. So not going to communities with more than immunization is really, really important, because then you build trust, you build understanding, and then the community welcomes you. So that community right now, everything they want to do, they call on the NGO to come out and work with them.
Excellent. Thanks so much, Chizoba. That's and I think that's a point that we were talking about at the beginning, is that if we know a community has missed out on immunization, they likely have missed out on other health interventions. And I think that's an approach we really have to try and take more, is particularly when we're just addressing zero-dose communities, because you can be assured that if they've missed out on immunization, there's nutrition and malaria and other interventions that these communities require, that we need to try and work together better and see how we can try and deliver these in a more comprehensive way. And Jack, there was a question that came up related to some of the expedited policies and processes that happened during COVID-19. So we've seen in some countries that some policies have been expedited, and this question comes from someone who said that CSOs are sometimes not there at the decision-making table, and if this was something that was experienced in Kenya, especially around engagement of parliamentarians and other decision makers. So was this a problem in Kenya in terms of trying to engage CSOs in the decision-making table? And if it wasn't, how were you able to overcome this to keep everybody around the table, particularly when it came to the discussion around financing? So Jack, would you be able to address that question?
Okay, yeah, sure, Dr. Laura. Yeah, I think this has been a case in many countries whereby the civil society feel they're being left out. Let me even say this, at the onset, especially the planning for COVID-19 interventions, the CSOs felt were being left, and I believe this is in so many middle, or let me say developing countries. I think along the way you engage with the government really matters a lot, so that you can be able at the decision-making table or engaging with the government. I think for our case has been a bit different, whereby we've been involved in the immunization programming, let me put it that way, at the country level for almost a decade, whereby you basically have to partner, collaborate, and work with the various players, starting with the national government, the county government, UNICEF, WHO, the various work streams that are in country, all the way from the annual work planning, the Gavi joint planning, and all that. We didn't necessarily have major challenges in terms of getting to sit on the table, but this also speaks a lot about our history in terms of engaging. But moving straight to parliamentary engagement, I think there's a way generally, if you're gonna initiate, for example, parliamentary engagement, there's a way we need to go around it. The first thing we have to learn that we are doing it in partnership with other players. So you can be a lead partner, a lead player, but you're doing it together with the Ministry of Health, especially at the national level, or even at the county level, the case of Kenya. Just in a nutshell, how we did our parliamentary meetings is that the National Vaccines and Immunization Program, that is the API program, usually request us to facilitate and lead in terms of mobilizing. But the facilitation, the presenting of the issues is done by the ministry itself. So our role is more facilitatory, and whereby obviously we're able to bring in other players, civil society, the media, and all that. But then again, the key people who wants to make a case of immunization financing, for example, you allow the head of the API program to make that case. If you get other invitation, at times when we are facilitating such meetings, you get invitation from the TB department. They also want to make a case, nutrition. You allow them to, to come in and make a case. But our role is more facilitatory, talking and working very closely with the key players. And also in country, these are what I refer to as the key immunization stakeholders and players. It's not much of a challenge, but possibly to hear from other countries. But this is because of our history and our advocacy engagement, possibly as an organization for the last over 3 decades.
Great, thank you so much, Jack. That's really helpful perspective from Kenya. And we only have 1 minute left, and there's many more questions, but I'm afraid I think we'll have to wrap it up here. But I think it's been a very, very interesting session, and I think a lot of food for thought and a lot of opportunities for improvement. And I think just to make you all aware that WHO and UNICEF presented to the Strategic Advisory Group of Experts in Immunization last week some guiding principles for recovering immunization for 2022 and beyond. And I think much of what has been discussed here has been addressed and kind of echoed by our speakers and our panelists. So I want to thank all of you for your questions, for your inputs, and also a huge thank you to our 4 panelists, to Jack, Edmund, to Chizoba, and to Viorica. I think you've highlighted some really, really key and important issues, and I hope that going forward that there can be opportunities for more learning. And I think this is the first of 3 series of webinars. So look forward to the next 2. And thank you all for your participation today. And unfortunately, we couldn't address all the questions, but I suppose that's what happens when we have interesting panelists and speakers and experiences. So huge thank you to everybody, and I hope you can join for the subsequent 2 webinars that are coming up. Thank you.